Hey, hey, Perimenopause Hub Bitesize. Doctors.
So today we're going to cover when you actually need to speak to your doctor. Now, just because you are going through perimenopause doesn't mean that you need to inform your doctor or anything like that. When you need to speak to them is when you are noticing symptoms that are really impacting your life, and also if you want to investigate something further. For example, if you are noticing you are constantly fatigued, if you are noticing that you're constantly feeling cold and things like that, this could be a symptom that there's something wrong with your thyroid. So you'd want to get your bloods checked just to make sure this isn't the case. And if everything comes back clear, then it probably is perimenopause. And also, if you want to look at going down the HRT route, then that is also when you would need to speak to your doctor as well.
Absolutely. Which brings us then on to the how to speak to your doctor question. Now, that might seem ridiculous. Hi, I'm Emily. Hello, doctor. Please, can you give me HRT? You'd think would be a nice, easy role play. Unfortunately, it isn't always that straightforward. Without getting drawn into the politics of it, menopause is not as widely taught at medical school as we would like it to be. So you may find that when you go to the doctor, you need to be quite assertive about what you want. So please, please, please use this series of videos, use the hub, use the resources available to you to decide what you think is going to be right for you, what you think you're going to want, and then use that as an opener for the discussion with your doctor. Ideally, when you ring up to book the appointment, ask to speak to the women's health expert in the practice. This may not be a doctor, it may be a practice nurse, and that's absolutely fine. But ideally, you want to be speaking to the person who is the women's health expert, because they are going to be more inclined to understand what's going on and to give you what you need. Further to that, and something that we say all the time, ideally, you want to have been tracking your symptoms, your periods, all that sort of stuff before you go to the doctor, so that when you turn up, you can go, look, things are changing. Things are not as they used to be. Please help me. As opposed to just turning up and going, which I've done many times over the years. Bear in mind, your doctor only has maybe 10 minutes to speak to you. So you want to ideally be doing everything that you can to help them to help you. Now, I know when we're not really sure what's going on and we're feeling really crap and we're feeling lost and all the rest, we just want the doctor to make it better. And I completely get that. And it must be so frustrating for doctors that they can't just make it better, because that would make their lives so much easier. But because there is such a range of symptoms, and because we all respond slightly differently to our hormones and things, when it is a hormonal thing, as obviously Peri is, the more you can work with your doctor to help him or her to understand what you're experiencing, the sooner you will get to the outcome that you want.
Definitely. So keep tracking. If you've not already started tracking, start tracking, and just think what the outcome is.
Yeah.
What do you want? Do you want to feel better? Do you want to look at HRT? Do you want to rule out everything? And keep an open mind, because your doctor might want to try a few different things before they find the right thing that works for you, and that's okay.
And one last thing, there is not a definitive test for perimenopause. The doctor can run blood tests to look at your hormone levels, but when we're in perimenopause, our hormone levels are doing this. So they may well not get the blood test at the time that will show them anything useful. The NICE guidelines state that in women over 45, diagnosis of perimenopause should be on symptoms alone. However, as Jade has said, there are a lot of things that have similar symptoms, and you would always want to be getting a blood test to rule those out, but the blood test itself will not necessarily rule in perimenopause. All you're doing is excluding other things, and then by virtue of your symptoms, age, if you are over 45, even if you're over 40, frankly, should then move you along to this diagnosis. But you don't need to go to the doctor. If your symptoms of perimenopause are not impacting on your life and you're fine as you are, carry on. It's absolutely fine. If you want to address this through nutrition, through exercise, through any number of other things, do that. This is not like type 1 diabetes, where if you do not have insulin, you will become immensely poorly. However, if your symptoms are severe enough that you want to take medication to manage your symptoms, HRT is not a dirty word. It is not a bad thing. It is there to help you, and it is the medication that can help you. So your doctor is the person with whom you want to ideally build a bit of a relationship and help them to help you.